All right, good morning, everyone. We're going to go ahead and get started. As you may have noticed, I'm not Isaac. My name is Kat Seifert, and I am a program advisor here at OTDA. I've been working on CPRAC since January 2023, and I'm really excited to be at this table with you all today. I've been working on, before we get into today's meeting, we will address the other shifts at this table, but rest assured that our same small but mighty team remains dedicated to advancing CPRAC's work. And I just wanted to acknowledge that, as of yesterday, it's been 3 years since our very first CPRAC meeting.
Yay.
So happy birthday to CPRAC. As always, we're eager to get started. We have a lot to cover. First off, bathrooms are located to the right of the lobby doors down the hallway. And in terms of breaks, we will have a brief intermission after our first guest presentation. So, and feel free to grab water, coffee. We have lunch for you. And once again, as always, our meetings are subject to New York State's open meetings law, which means that this meeting is being live streamed and recorded so that people watching after the fact can follow along. Can you advance the slide?
Yes.
Okay, and here's an overview of what we'll cover during today's meeting. As we always do, we'll start with a recap. We'll start with where we left off after meeting 14. Then Commissioner Gwynn will present updates to the federal context, including reviewing the enacted federal budget that was passed in July. And we'll consider the implications of this budget on our next steps as a state and a council, and how it will impact our strategy moving forward. We'll also have a couple of guest presentations today, a researcher and a Minnesota state government employee. Both will focus on the topic of child tax credit take-up. And for the discussion section of our meeting today, we'll talk about takeaways from each of these presentations, potential lessons for New York State, and what actions we may be able to consider that would boost awareness of and enrollment in the child tax credit. Then we'll talk generally about next steps, including meetings that we have scheduled for the rest of the year in service of issuing this year's progress report. But first, we'll want to start with some brief remarks from our co-chairs, Deputy Secretary Peter Hatch and Commissioner Gwynn. Peter, are you with us? Would you like to say a few words?
Thank you, Kat. Can you hear me well?
Yes.
Great, appreciate it. Good morning, everyone, and particularly to our members. I want to thank you and thank our presenters for joining us and all the other participants who are up in Albany for the 15th meeting or joining by Zoom. Please forgive me for not being with you this morning. I had to staff the governor in New York City, so I'm going to be one of the Zoom participants today. I want to first thank Kat again for stepping up at OTDA and helping to lead this work of the CPRAC, and relatedly excited to announce that Isaac has joined Chamber as our new Assistant Secretary for Human Services and Mental Hygiene. But we will all continue to work together as a team, with Commissioner Gwynn to keep this work moving forward. I must say, unprecedented times, we're here to have this important conversation in the context of a social safety net that's under attack. I hope this governor's administration has been fighting every day. First, engaging in federal advocacy, including, Commissioner Gwynn's incredible Senate hearing testimony, fighting in court every week, trying to share, impact information, both with our partner organizations, many of whom are represented here, but also with everyday New Yorkers. It remains a rapidly changing landscape, of course. We're getting new guidance by the week, sometimes by the day. Unfortunately, the bottom line is there are going to be billions of dollars of negative impact for New York. We know New Yorkers are going to lose benefits. And the dust hasn't even settled right on SNAP and Medicaid, some of the federal grants. We don't know yet the extent of impacts on TANF, housing. So we're going to face some tough choices. This governor and others have pointed out that no state can backfill the federal cuts that are anticipated. But a thing that makes me somewhat hopeful is the conversation we will have today about doubling down on recent actions inspired by the CPRAC's recommendations to make sure that, historic investments in New York State actually reach the people that they are intended to. The child tax credit expansion is just a central pillar of Governor Hochul's affordability agenda. And I am incredibly excited to hear from our presenters today. We built here in New York on the, historic expansion from the Biden administration during COVID. In a prior life, I led New York City's efforts to drive uptake of the credit there. And I remember those weekly strategy calls with the White House. So it makes me hopeful to have this conversation and hear from experts and from all of you as to how we can best do this. Anyway, let me hand it to my co-chair, Commissioner Quinn. Thank you.
Okay, thank you, Peter. Good morning, everyone. Also welcome you back, and thank you all so much for participating and giving your time and attention this morning. Also, congratulations to Isaac. I must say that the first time we learned that he would be, quote, loaned to Chamber, that he would never be seen again as an OTDA employee. But we are very thankful for his work and his leadership, and also thankful that he will be continuing to work very closely and keeping CPRAC as a part of his important portfolio. So thank you. Our last meeting on June 10th, we spoke a little bit about what could happen in terms of federal action. As you all know, since then, a lot has happened, including the passage of H.R. 1, which was signed into law by President Trump on July 4th. With the passage of this law, the federal government has significantly taken steps to weaken the social safety net of our country, including many of the programs that this council has been focused on and is concerned about. Certainly, we want to do everything we can to protect the vulnerable citizens of New York State, and we will continue working in the months and years to come to make sure we're able to do that. Definitely want to also acknowledge and thank the members of this council that submitted quotes in support of efforts to oppose the changes that in fact were eventually enacted, and also a big thanks to Kate Breslin and Rich Bury for joining our agency as we also tried to get the word out about how serious what was being discussed at the time was in making sure that people understood what was in the bill. Since it's passed, I think we have clearly learned that not everyone, including some who voted for the bill, were acutely aware of what was in the bill and are trying to see if there are ways to preserve some of what was enacted. And of course, now we are in the midst of a federal shutdown, which is also quite unsettling, to say the least. We're thankful at our agency that we were able to issue October SNAP benefits on a routine basis, but it is unclear what will happen with November. We received guidance at the end of the day this past Friday from USDA instructing states to not submit their November files to the vendors to begin processing November payments. So we certainly are discussing what options there are, but quite admittedly, there are very limited options unless Congress and the president take action to preserve SNAP benefits. So, amongst all of this, we need to continue to work and make sure that the important items for CPRAC are enacted and that we can do what we can to support vulnerable New Yorkers. The policies enacted last year by Governor Hochul and the state legislature certainly have helped us start moving in the right direction on some of the topics important to this council. The baby benefit, which is a $1,800 payment that will be made to parents on public assistance for children born on or after November 5th, is on way to implementation. We have draft regulations. The comment period ends today, and we intend to turn that around in quickly so that we do have those regulations promulgated in a timely manner. The Housing Choice Voucher Program pilot, which is being implemented by Homes and Community Renewal, has a procurement that was closed on October 10th, seeking administrators for those voucher payments for lower income households to help them meet their rental needs. The expectation is that the awards for that procurement will be made in November, mid-November. And then also, most important, and what we're going to spend quite a bit of time talking about today, is the New York State expansion of the child tax credit. Certainly, we've talked about it a lot in terms of, changes are great in terms of law, and that's the first step. The next step is implementation, and that we're working jointly and collaboratively with community partners to make sure that those who are eligible for this now new enhanced meaningful benefit file to receive that payment. And so we will do everything we can working with you and of course the tax department to make this as simple as possible and to make sure people are aware of the substantial credit and do in fact apply for it. So at this point, I'd like to just have the members of the council introduce themselves, and we can start with Marie on the phone.
Good morning, I'm Marie Cannon from Community Action Organization of Western New York.
Good morning. Richard?
Good morning, Rich Bury from Robin Hood in New York City. Good to be with you this morning.
Okay, thank you. I think that's it on the phone, and we'll turn it over to Scott.
Good morning, everyone. Scott French, New York City Human Resources Administration.
Morning, Kate Breslin, Schuyler Center for Analysis and Advocacy.
Good morning, Dia Bryant, Context Matters Strategy Group.
Good morning, Pete Nabosny, the Children's Agenda.
Kathy Connerton, Southern Tier Regional Economic Development Council.
Candace Cabral, Community Member.
Good morning, everyone. Vanessa Threet, Executive Director, Council on Children and Families.
Good morning, Kristen Dents, Tax and Finance.
Okay.
Back over to Kat.
Next slide, please. Okay, as usual, separate from our table of contents, we are also presenting our agenda in goals form. We will recap meeting 14, including what was enacted in the state budget and what was proposed in the House bill, as well as what has happened since on that front. Then we'll provide an update on the federal funding realities that we're facing, specifically via the One Big Beautiful Bill Act that was passed this summer and the federal government shutdown that we are currently in. Then we shift to our presentation section, where our guests will together provide an overview on the issue of child tax credit promotion and utilization. Our first presenter will be a researcher academic from New America's New Practice Lab, who will present her research on tax credit uptake and delivery. After that, we'll take a brief break before welcoming our second presenter from the Minnesota Department of Revenue, who will present on how Minnesota has promoted their state CTC. Then we'll open things up for discussion on options that New York can consider to increase take-up with one of the key programs that New York just expanded, the Empire State Child Credit. And before we end today, we'll look ahead at our next steps for the year, including our plan for issuing a progress report in December, which of course requires an interim meeting between now and then, as we have in prior years. In your folders, you will find our agenda, this presentation, our two guest presentations, and our running bibliography, which is up to over 330 sources at this point. And maybe we should stop printing it because it's so much paper. And with that, I'll turn things over to Isaac to give us our recap.
Thank you very much, Kat. Good morning, everybody. Great to be here with you all. Oh, thanks. So as mentioned, as usual, we'll recap our prior meeting, which was a little similar to today's because the subject of both meetings, a large subject of both meetings will be the actions of the federal government. So last time we were together in June, we reviewed the enacted state budget for state fiscal year 2025-2026. We talked about the, at the time, threatened actions of the federal government and what was sort of rumored to be coming. we level set on the potential impacts of those threats on CPRAC and the necessity of responding to the scope of federal attacks by reevaluating our strategy. And we discussed opportunities and limitations in this context. So we talked about severe cuts and funding constraints, limitations on backfilling. We talked about our advocacy with the federal government and representatives, which Peter and Commissioner have recapped some of the highlights of. And we talked about the importance in that, against that backdrop of maximizing the reach and effect of our enacted policies. And as everyone has mentioned, this is what we'll really focus on today related to the most significant proposal from our area in the enacted state budget, which is the expanded child tax credit. Not going to spend too much time on it, but just a quick reminder, because this is still holding on to this good news from our recent state budget. The budget did include actions in all areas that this council recommended. So there was the child tax credit expansion in the tax policy area, the baby benefit, moved the ball forward in the public benefits area, universal school meals will increase food access for folks across the state, and the housing access voucher program pilot, which is intended to roll out in the first half of next year, looks a lot like the housing voucher proposals that we talked about. Clearly, these aren't all directly, explicitly advancing each of CPRAC's recommendations themselves, but each of these actions advances New York's commitment to providing a service and support in these key areas, all of which we think will help to reduce child poverty. It's also important to note that the progress we've made here, as we noted last time, is state-level progress, actions that are not directly vulnerable to federal threat. Of course, there are some asterisks, but for the most part, Urban is working to estimate the child poverty effects of each of these proposals individually and in combination, and this is the work they'll really focus on from now through the end of the year. The goal is for them to provide updated estimates that we can cite in our end-of-year progress report. The truth is, the realities of the federal government and what we are dealing with have also affected Urban Institute. So we have been getting our arms around impacts and sort of restarting our arrangement together. They're first beginning work for us on this task this month. So that's really sort of the main and only thing that they'll be able to focus on for us between now and Christmas. So as mentioned, we reevaluated some of our strategy in light of all the federal actions, and as we've covered and now have a lot of detail to demonstrate, we're operating in a new federal context. So billions of dollars in benefits that flow from the federal government through New York State are being cut or jeopardized. Billions of dollars of costs are being passed to state and local governments annually. And it's clear that the Trump administration is actively targeting key aspects of our work in human services. Refugees, immigrants, diversity, safety net, cost shares, programs to prevent poverty, and more. This means we must sort of reality check about the severity of what we're facing. States across the country have talked about how the size and scope of the cuts being pursued by the Trump administration cannot be backfilled. But we've also talked about our number one goal is to protect our social safety net and ensure New Yorkers can access the programs they are eligible for. And so to that end, as Peter alluded to, New York State is joining other states in fighting back in court to preserve services and funds. It is really an all-hands-on-deck effort, unified advocacy and targeted advocacy. Before I continue, I just want to acknowledge that Pamela Walcott has also joined the Zoom. Good morning, Pamela. Thanks for being with us today.
Isaac, this is Isaac. I hope you can hear me. This is Dr. Harris Madden.
I didn't see you there.
While driving.
Oh.
Yes, I just joined. I'm driving, unfortunately. So I am in listening mode. Thank you.
Thanks for your shout out, and sorry to miss you, and welcome. Thanks for joining us, Commissioner Harris-Madden. So in our last meeting, we also talked about how we had reconvened two of our committees who had sort of paused their conversations last year. That's the Employment and Wages Committee and the Childhood Committee. So earlier this year, in the spring, we did resume discussion of ideas for potential analysis. Those discussions are proceeding, different focuses, and each have different paces, as has always been the case between committees. But with each group, we are honing ideas and trying to achieve consensus on what ideas we should take to urban to explore modelability for. And once those ideas have sort of been identified and solidified and agreed upon, urban will assess the feasibility of modeling them. That assessment is something that they won't be able to do until, as I mentioned, they've completed the work analyzing our enacted policies. So that assessment, logistically, they won't be able to get to it until we get into next year. So we have time, I should say, to hone and solidify those ideas. And if modelable, if modelable, the ideas that are advanced by these committees could potentially complement some of the enacted policies from this past year. And for that, we would follow a similar process with urban, where we obtain data from them, and then we're sort of guided by the data in discussing which policies and priorities we want to advance, and in what order and in what combinations. And that sort of familiar forward-looking modeling and iteration process will take place next year. Timing is really TBD as we move into 2026 and map out our post-February meeting schedule, but that is when they will be able to do that sort of forward-looking modeling in earnest. We hope to have them fully in place so we could hit the ground running then. Yeah.
Before you move ahead too far, on the urban estimates for the impact of last year's budget items that we're expecting later this fall, I recognize that contracts are limited and their capacity is limited and everything, but is there any estimate that they'll be able to produce at any point of the sort of the backsliding effects of the federal cuts on this work, or what the expected impact for SNAP cuts, for example, will do to push in the opposite direction?
Yeah, so I think broadly, yes. Before the end of the year, no. What that looks like is sort of to be determined. So something we've talked about is, as part of our measuring the state's progress, not only are we going to be projecting estimated effects of all these policies, which, as a reminder, every one of our stats and figures is a projection about what could be achieved using 2019 data as the baseline. So in addition to doing projecting, we are going to have to look at census data with urban for them to actually see sort of what has taken hold and sort of how far those projections have gone, what is sort of the actual impact on the ground. Of course, there is lag in census data. So the census data that will come out later next year will only first begin to show the effects of the child tax credit stuff. So that is a piece of work that will happen under our next contract with urban, is sort of looking at, okay, here are our projections, what was the reality, and we've already begun talking to them about how to make sense of that in light of all the new context. I will say, as Peter and Commissioner mentioned, I think it will be hard for them to, today or tomorrow, estimate the effects of all these changes, because they are still live and happening actively. We are just getting guidance in the past week and a half on how we're going to implement changes that are estimated to affect more than 300,000 people. There's another tens of thousands of people who will be affected by non-citizen restrictions for which we have not received guidance yet. So the answer is yes, but at what point do you sort of say, okay, we're going to analyze starting here, because you have to pick a fixed point, right? So I think a little bit of it is trying to get our arms around the full scope of the damage before we're sort of saying, okay, now is the point at which we will say, this is our baseline for that kind of impact. It's a billions dollar question. It's not $1 million question. It's a billions dollar question because, it's it is constantly changing. It is constantly chaotic. And so at what point do you sort of say, all right, enough is enough, we'll analyze from there, or wait and sort of keep seeing it change? So that's a complicated way of saying yes, but we'll have to figure it out a bit. It's going to take some thinking. So speaking of which, and speaking of how we describe and how we track and keep up with all of the insane changes that are coming down the pike from the federal government, I'm going to pass to Commissioner Gwynn to sort of do a recap of what we now know from the One Big Beautiful Bill Act. Commissioner.
Which I refer to as HR 1 because I can't let those words out of my mouth, but...
I agree. Scratch that from the record.
That's okay. So, as we mentioned, certainly a lot of concerning actions regarding federal investment in the social safety net. With the bill that was signed on July 4th of this year, it includes, again, significant reductions in federal support for the Food Assistance Program, Supplemental Nutrition Assistance, or SNAP, as well as support for Medicaid and healthcare coverage. Both programs also have new rules in place that will make it more difficult for individuals to maintain eligibility, including work requirements. The Medicaid work requirements are in the future. The SNAP-related work requirements are rolling out as we speak. There also were changes with respect to direct file for tax filing purposes, eliminating the existing direct file and evaluating what potentially could replace it. So I assume that also has an impact on what the state is able to do, but fortunately we'll hopefully hear some from Kristen later as we talk about rollout of the child tax credit changes. And then also at the federal level, there were some changes to the federal child tax credit, a modest increase in the credit, but also changes or lack of changes that would really improve the impact of the child tax credit. So again, a modest increase in the maximum benefit that's available to households, but it did not address the requirements needed to really address the equity issue with respect to allowing those households with the lowest income to access the maximum federal credit. I think that is something that is worth a lot more attention. I think that that we were able to achieve that change in New York State was certainly a significant policy shift in the right direction. And I think that's a good place for efforts to be focused in terms of federal advocacy to help make that what is a pretty popular tax credit from a bipartisan standpoint to allow it to help the lowest of income. The other changes also, which would be a negative, is that it now will require that both the child, which has always been required to have an SSN to receive the credit, but also for at least one parent to have an SSN. So some restriction of access there to the child tax credit at the federal level. With respect to SNAP specifically, just a reminder that SNAP helps 2.9 million individuals in New York State afford to put food on their table. And it certainly has a very broad reach in New York State and other states. The change from a funding standpoint was to, for the first time ever, shift a portion of the cost associated with issuing SNAP benefits to the states, and to do so under the guise of reducing fraud, waste, and abuse. So a state's share will be determined based on their error rate, and error rates can dramatically change from one year to the next. And so as an example, New York's error rate in 2019 was 6.3%, and currently we're around 12.6%, and continuing to evaluate the federal year 25 error rate. factors contributing to those error rates. It does not measure fraud. It does measure the inappropriate or benefits that are issued either at an amount that's too high or too low based on the household circumstances. And just one change at the end was that instead of a 25% shift to states with error rates over 10%, it said 15%. But for New York State, that's over $1 billion. In terms of the states that would not have to contribute to the benefit, it would be if you have an error rate that's under 6%. As of fiscal year 24, only 8 states had an error rate under 6%. And those states that have to pay the highest share, if they have a payment error rate that is 10% or higher, and 20 states as of fiscal year 24 data fell into that measurement point. So significant cost shifts from the federal government to the states. Also a cost shift in terms of reducing federal reimbursement for administrative cost. The federal reimbursement was reduced from 50% to 25%, also shifting those costs to state and local governments. As we've said before, one of the most powerful impacts of the SNAP program has been that the benefits themselves were federally funded 100%. Which has really helped it be a really impactful and stable program over the years because states must balance their budgets. And so in difficult economic times, we are certainly concerned that the cost shift could change the landscape for the program across the nation. And with the work requirements in SNAP, these are time limits. So it essentially, if someone is able to work and is not exempt for some reason, they must participate in 80 hours of employment or an work-related activity in order to maintain their SNAP benefits for more than 3 months. So the bill itself did a couple of things. It expanded the population subject to these requirements, and it also eliminated the authority for USDA to approve waivers based on insufficient jobs or economic factors in an area, in a state or areas within the state. We, on October 3rd, received guidance from USDA about these provisions. New York State had a waiver in place that was scheduled to terminate at the end of February of 2026. The October 3rd guidance indicated that our waivers would all be terminated effective November 2nd. So not a lot of time, to say the least, in order for us to handle the existing population, which USDA is indicating that we must do, quote, all at once. So all of those households, it's over 200,000 individuals in the state that had previously been covered by a waiver, will need to be notified of the requirement and expected to begin participating with the first month that could potentially count toward their 3 months starting in December of 2025. So to say an implementation challenge is definitely an understatement. But we are doing everything we can to get the word out and to make sure individuals understand how they can meet the requirement. In addition to early termination of the waiver, and in terms of expanding the population subject to the time limit, increased the age from 54 to 64 years of age. Also, for the first time, includes certain households with children, which would be households whose youngest child is 14 years of age or older. Previously, it excluded all households with children under 18 years of age. And the bill eliminated exemptions for certain populations. And so that includes veterans, individuals who are homeless, and young adults aging out of foster care. So for the new population, so the previous ABOD population requirements are starting immediately. We're notifying folks. For the new populations, It will be a more orderly transition. It will be at application and recertification that those households will be potentially subject to the time limit unless they are excluded based on a new assessment of their characteristics. So again, that guidance was received on October 3rd. We've issued draft guidance to social services districts as of October 7th and have held calls with district commissioners as well as staff in order to prepare for the implementation of these requirements. And this Thursday, we will be holding community calls with community-based providers, also to update them about what's happening. It is important for people to know that one way, and people can meet this work requirement in a number of different ways, and that includes if you're earning a certain amount, it's $200 and something a month, that would render them exempt, and also through volunteer or community service that is at the hourly requirement of their SNAP allotment divided by the state minimum wage. So in New York, for most households, that would be, for an individual, somewhere around 18 hours a month. So that's another way that individuals can meet it. And then also people can meet the requirement through job search or education programs. So more to come as that rolls out. So again, a significant cost shift to the state and loss of SNAP benefits, both through the work requirements, but also for non-citizens. The bill further restricted non-citizens that are eligible to receive SNAP benefits. We're estimating around 40,000 individuals will lose SNAP benefits once those changes go into place. We have not received guidance from the federal government on this provision. However, based on guidance in other areas where we have received guidance, my expectation is that that will be in place as of November 1st. But again, we do not have guidance from the federal government yet. So all in all, it shifts about a $1.4 billion cost onto New York State, and then also will result in the loss of projected loss of over 900,000 million. Yeah, 900,000 we got out. 900 million, we don't got that. So 900 million in benefits, which of course has a significant impact on communities throughout the state. SNAP not only helps households, but also helps communities, supports grocers, and has an economic multiplier to really produce significant investments in jobs and businesses and communities throughout our state. Additionally, major changes, which has been getting a lot of attention in the news with respect to changes to how the federal government supports health insurance. So with Medicaid, they also that program also will be subject to work requirements based on the provisions of the bill enacted this past summer. Able-bodied adults ages 19 to 64 would be subject to work requirements in order to maintain their health benefits. This is currently expected to take place in January of 2027, and guidance is pending. Another huge impact for the Medicaid, and that is the cut in the federal funding to New York State for our essential plan. In a couple of years ago, New York State took steps to significantly expand coverage, and through that expansion of the essential plan, we were able to cover about 450,000 additional individuals in New York State and provide health insurance. Based on the changes to the bill, New York has put forward a request to roll back that expansion because it will no longer be supported by federal funds. So a significant concern in terms of loss of coverage for individuals through the essential plan, and also expectation of households and individuals losing Medicaid due to upcoming work requirements, and also changes in terms of the certification requirements, kind of additional effort that will be required to be put forward by households to maintain their SNAP benefits. So huge impact in terms of dollars, about a $13 billion hit in New York State. Obviously, there's a lot of concern both for individuals, but also for communities and health hospitals and healthcare providers in terms of their ability to maintain their business. So significant, as I'm sure you're all hearing, there's a lot of talk right now about the federal shutdown and trying to undo some of these changes that were put forward by the H.R. 1 bill. And then we have some examples just to show different districts. So we held kind of rallies, I guess you would call it, in a couple of districts with the governor over the past couple of months, both in Pat Ryan's district, District 18, and then also in the district of Richie Torres and the Bronx. And these are just some examples to put it in context of the impact of these changes on these communities. So somewhat alarming in term, especially if you're looking at those numbers for the Bronx. So again, not a lot of positive news to report in terms of changes in terms of the federal reduction in the basic social safety net for this country. As I mentioned, significant reductions in people's ability to access food, people's ability to access health care, and I think it remains to be seen what's going to happen with respect to housing. So, food, healthcare, housing, some of the basic needs of individuals is definitely under attack as we move forward. And that is it. Thank you.
Thank you, Commissioner. As you can imagine, this is a lot of information to process, and that just scratches the surface of all of the complications that we're facing and trying to keep track of. But moving right along into our presentations, can you advance the slide, please? Thank you.
Could I just jump real quick before we get to the presentation, just on, obviously that's a list of horribles that we've heard there, and many things that are going to be incredibly harmful to lots of New Yorkers, including the group where we're interested here in reducing the effects of child poverty and all. And so I'm wondering so these things are happening, they're happening at different speeds and with different amounts of information that we're learning about. And just as we're kind of going to go through next, the sort of improving uptake on the child tax credit, it makes me think that there is going to be a lot that New York is going to have to do to help people maintain benefits as much as possible, particularly to comply with the onerous work requirements and paperwork requirements and all sorts of other things. And so as we get more information, as these things start rolling out, and as there's more questions from the community about why I'm losing this and that and what's happened, if we could at a future meeting just have a presentation around what OTDA, what local social service districts are doing, what community partnerships that are out there that could be getting funding to do some of this navigation service, things like that, like just getting some sense of how New York is responding to these cuts, that would be really helpful, I think, for me certainly, and I think for the broader public too, who may pay attention to some of these things.
Yeah, absolutely. We are, like I said, we've started our communication strategy. We are holding calls with community providers. This Thursday, we have a couple of sessions to get people up to speed in terms of what's happening, and we are also about to release some additional information on our website, including what we hope will be a very plain, understandable document that explains exactly what are the options people have for meeting the requirement or potentially coming forward and saying, my status has changed. I'm no longer able to work, or whatever may have happened, in an effort again to help people maintain their benefits. And certainly providing volunteer opportunities for folks is certainly one way that community organizations can be helpful, but always helpful to make sure people are informed so that we, at a minimum, can provide the best information to individuals. I will say that in New York, we the federal rule does not require us to do anything other than notify people, but I must say I'm proud that New York is continuing to work with our local social services districts to make sure that people who want to comply have an opportunity to do that. And I must say there has been, even as difficult as this implementation has been, we have not had a single social services district complain about having to help people, like push back, saying we shouldn't have to do that, it's too much work. So we will continue to do that, and very thankful to our local partners and certainly to community-based organizations to help us move forward. Thank you.
Commissioner, can I ask one other question? Is there any effort to sort of evaluate from a community-based organizational standpoint? So I know we're focused on recipients, but I also think about, I mean, my world is hospitals, so we're obviously very impacted by all this. But do we also understand, I mean, that safety net infrastructure is in trouble. And so it won't just be recipients, but if the infrastructure is not there to help support the government in this, there's going to be organizations that close, right? There's going to be hospitals, more hospitals that are going to close. So what happens in that infrastructure, and is there a separate work stream that needs to happen to evaluate that?
Yeah, and you're absolutely right. It has impacts throughout communities throughout the state. It's not just those who are benefiting from the services, but from the community in terms of the infrastructure, the important infrastructure. Certainly those conversations are taking place among the state agencies, but you're absolutely right. That will be important to do what we can to prevent a disruption of the infrastructure while we hopefully work our way through this time period. And then also certainly to evaluate any negative impacts as well from a community standpoint. And would you like to introduce yourself since you have joined us?
Hello, everyone. I just joined, very late train, Grace Bonilla from United Way of New York City. I had just like some very concrete questions. As you are looking at the budget, I'm sure that there are a lot of tough decisions. And you're probably the wrong commissioner to ask, but I'll ask anyway. Have there been any discussions on increasing things like HIP, NAP, and Nourish to help our pantries?
So budget is being discussed right now actively, and certainly people are exploring all possibilities of what the state can do to help, in particular with the immediate impact on hunger, which we know the service needs are already high even before these changes are implemented. So certainly that's something that's part of the discussion.
Okay, and do we know anything about the 1115 waiver? I know we have a couple of years with that, but given the unpredictability of this federal government, just wondering.
I do not.
Okay.
But certainly can take that back to the Department of Health to see if they've heard anything.
Thank you very much.
Unless others at the table have any information on that. No, okay.
I chair our PPC in the Southern Tier. So far, what we've heard is that there's no impact to the 1115 waiver, that we're to continue going forward, but we all know that can change quickly, so, but that's what we're operating under right now.
Thank you. So as CPRAC has discussed and established, cash transfer programs for children, including child tax credits, are key tools for putting money into families' pockets and reducing child poverty, but it will only have this impact if our lowest income families are able to access it. Like we've talked about, and the research shows, and Kristen has affirmed, that the lowest income families are the least likely to know about and claim the child tax credit, especially if they have no filing obligation, since non-filers are not known to the tax department. If these families who need the credit most are unaware of or unable to access the credit altogether, New York State will not achieve the projected 8% reduction in child poverty that the Urban Institute estimated would result from this policy. To that end, we as a state have an obligation to reach as many eligible families as possible. And to do that, we must make a concerted effort to promote our expanded child tax credit and conduct outreach, especially in light of the elimination of the wage phase-in, which was intended to make more families, in particular the lowest income families, eligible for the credit than ever before. Throughout CPRAC's work, we have talked about the challenges in reaching or even learning about non-filers, and Kristen has flagged that limitation throughout our discussions on the topic. And with that backdrop, we've invited a researcher who has studied non-filers specifically, along with their rationales and motivations, Devyani Singh from New America's New Practice Lab. Devyani and her team conducted a national survey which targeted low-income households to learn more about their experiences filing taxes and accessing these tax credits, and the barriers that keep them from filing at all. 88% of her respondents were in households making under $65,000 per year. This, of course, includes the poorest families and particularly non-filing households, the population that we are trying to learn more about so that we can make every effort to reach them. Her presentation will review the findings from this research and will outline potential strategies for improving low-income households' access to tax credits. And as usual, we will have a Q&A in which she'll spend a few minutes taking questions you may have about her work, her findings, and her proposed paths forward. So without further ado, please welcome Devyani Singh, who I believe is on the line with us.
Yeah, I'm here. Thank you, and thanks so much for having me on today.
Glad you could join.
Kat, I'm assuming you're going to run through the slides and
Yes, we are
does that
en
work?
route.
Awesome.
Yes,
Okay,
pulling that up now.
perfect. I can do a quick introduction until then. I'm Devyani. I'm with the New Practice Lab, which is a team at New America, a policy, action, and think tank based in DC. At the New Practice Lab, we aim to help make existing government programs simpler and more responsive to American families, particularly low-income families with young children. You can go to the next slide, Kat. And one of the ways we do this is by working with other organizations, states, and government agencies to expand and simplify access to tax credits, like the Earned Income Tax Credit and the Child Tax Credit for eligible families. Next slide. I won't spend too much time on this slide. I think everyone in this room knows this already, but there is strong and growing evidence that tax credits make a real difference in alleviating poverty, improving children's education outcomes, long-term employment, and even health outcomes like birth weight. Next slide. But despite their impact on reducing poverty and improving well-being outcomes, tax credits are still notoriously difficult for many people to navigate and access. The New Practice Lab works with state and non-state partners and local government agencies to help inform strategies and design interventions to improve both delivery and the experience of accessing tax credits for low-income families. Next slide. For today's session, I'm going to go over some of the things we've learned over this past year through the listening and research work we've done with families to better understand the barriers they face when filing taxes, particularly when trying to access tax credits. The findings I'll discuss today are from our survey of over 5,000 people across the country, including a smaller qualitative study through workshops and interviews that was led by our design team. We spoke with a broad range of households and oversampled those that had not filed taxes at all or had filed inconsistently over the last 3 years. And we oversampled households with annual incomes below $65,000. Next slide. So this is a very quick overview of some of the findings I'll go over today. You can also find them in our report. We organize our learnings based on the user journey of filing taxes, how people learn about their eligibility for tax credits, followed by their experiences with filing and receiving owed credits and refunds. Next slide, please. Go into our findings. I'll stop for a few seconds just so you can read the quote on the left side of your screen. So one of the things we learned was that the first breakdown often happens before someone even considers filing a tax return. Many people just don't know that tax credits exist, especially when they're not required to file because of their income levels. When we asked about awareness, 42% of households said that they had never heard of the child tax credit, and almost a quarter hadn't heard of any tax credits at all. Over and over, we heard people say, I don't make enough to file. And while that's often legally true, it can come at a real financial cost for these families. Um, Among low-income respondents who hadn't filed taxes in the last 3 years, a third said it was because they believed their income was too low. Yet within that group, we saw that many had earned income from work, even more households had children. And in other words, many of them likely would have received tax credits had they actually filed their taxes. So the first barrier is often awareness and helping low-income families understand that tax credits exist and that they might be eligible for those tax credits can unlock real financial support for them. Next slide, please. Secondly, across our survey and our qualitative research, another theme stood out. Families don't think about taxes in one uniform way. Their motivations, filing behaviors, and barriers are shaped by life experiences, financial pressures, and personal networks. We started to identify behavioral archetypes that helped explain some of these patterns, such as there were simplifiers who want taxes to be free and fast. People paying for expertise prefer to outsource risk or effort. Those seeking immigration stability file to stay in good standing. The weighing effort group file if the refund feels worth it. Those that are surviving with the safety net fear losing other government supports or benefits. The consistently owes group may have other debts that are higher priority to pay off in that moment. And the misinformed or unaware filers think that they earn too little or aren't eligible for tax credits for other reasons. And this means that a one-size-fits-all approach to messaging about taxes and tax credits can miss the mark, and that variety matters, especially for low-income families that don't plan to file or don't associate taxes with financial benefits. Simplifiers may respond to language about ease and speed, like file in 10 minutes for free. Those worried about benefit loss may need reassurances like filing won't impact your SNAP or housing. And misinformed or unaware filers may need help understanding that they are eligible for tax credits in the first place. Families we interviewed also said that language about missing money or extra income was easier to understand and resonated far more than tax-specific terms like credits or returns or withholdings. And timing mattered too. Many people in our interview said that they wanted to learn about tax-related opportunities early in the fall ahead of tax season, followed by reminders, especially actionable reminders during tax season. And our survey also highlighted the central role played by trusted messengers. People turned to a range of sources when trying to learn about tax credits, and common channels for gathering information were friends, neighbors, or family, followed by online searches, the IRS website, and tax preparers. Almost 50%, which was the sort of highest or most commonly named resource, mentioned personal family and friend networks, saying that they valued these sources for their trustworthiness, for their accessibility, and shared lived experience. Next slide, please. So for us at the New Practice Lab, this learning has meant that designing outreach about tax credits starts with meeting people where they are through their personal networks and trusted institutions. Shouldn't rely on a single channel or a single message, and it should speak directly to what motivates or worries different people. This can look like a few different things. This can look like partnering with local organizations and other state agencies that families already interact with and know, keeping messages simple, consistent, repeatable, tailoring outreach to different types of filers differently. For example, focusing on easing fears about losing benefits through human service agencies or highlighting financial gain through workforce development programs. And not relying on mail alone, using texts, emails, different agency websites to reach families early and often. Consistent communication well before tax season gives people time to plan and to act confidently. Before I move on, I'll turn quickly to my colleague Simone Brody, who's on this call as well, who's been putting this into practice through our new engagement in New York City. Simone, do you want to take a few seconds to talk about that work?
Sure. Hi, everybody. Yeah, I will just mention that we have started working with the New York City I-Team, who has already been doing some great work, actually doing outreach in NYCHA housing to connect folks that are in housing, to actually have them do outreach to their neighbors and friends and tell them about this work. And we're launching a small pilot in the fall, which is really testing different channels of outreach. So some is that there are some schools in Staten Island that are going to do outreach, connecting folks directly to VITA sites. And then another set of outreach, again, in NYCHA housing, doing something that is done, a version of something that is done in voting registration, actually, called relational outreach. And so having individuals text friends and families and people in their networks to let them know and sort of say, you know, I just found out about this credit and was able to access it. You can too. I think as Devyani continues to talk, we'll also hear about the barrier of awareness, but actually that there are many other barriers to the actual filing process. And so just how hard it is for people to find good support in filing. And so we're really testing in New York City this combination of outreach that connects people directly to support. And so they don't just know about the credit, but they can immediately find somewhere that can support them in filing. And I know there's already some interesting partnerships between New York City and New York State, where you're able to identify folks that may have filed but missed a credit. And so we're trying to kind of continue to expand on that work and find non-filers, which we saw in the previous presentation is, you know, continues to sort of be the black box often to find individuals that are really disconnected from the tax system. So really excited about the work we're already doing. And I think New York City is eager to continue conversations with the state as this expanded credit launches next year to figure out how we can let even more people know.
Thanks for that. That's awesome. We'll be keeping track of your work.
Thanks, Simone. You can go to the next slide. Yeah. So as Simone mentioned, once people know that these credits exist, the next big hurdle is actually filing. And even when people are aware of tax credits, the process of filing feels overwhelming and risky for many people. Across our research, both survey and our interviews, another strong theme we heard was the fear of making mistakes. More than half of the people we spoke to said this fear prevented them from filing at all. And this was especially acute among the lowest income households and among those navigating multiple jobs or non-W-2 jobs. Over a quarter of the survey participants said that they found it difficult to file taxes because they had multiple income sources and jobs. And when asked about challenges they faced, gig or freelance workers specifically shared that managing expenses and tracking earnings was difficult, and they were always afraid of making errors on their tax returns. And it felt like a system that assumes individuals are tax experts and requires them to navigate complex rules and jargon on their own, and the fear of getting it wrong is shutting people out from trying to file at all, and they're losing out on critical support as a result. This is where state agencies, especially departments of revenues, can make a huge difference. Next slide. Perception matters. A few small shifts in messaging can help make tax filing feel safer and more approachable for families who are feeling anxious. Instead of leading with enforcement or compliance-oriented language, messaging can highlight support. And small changes can go a long way. Emphasizing for low-income households that filing is a chance to access owed money and resources, not just a legal obligation. Normalizing mistakes and letting people know that small errors can be fixed and that filing isn't a test. Offering short guides or FAQs on common errors that people encounter. Linking directly to trusted state-verified resources like free filing tools or nearby VITA centers. And training frontline staff at adjacent agencies and community partners to echo this supportive tone, since many people feel more comfortable asking questions, in spaces that they're already familiar with. Next slide. So alongside fear and complexity, cost is another barrier that keeps people from filing or claiming credits. About a third of our survey respondents said that they found filing too expensive. And despite that, most still used paid help at some point. You can see on the quote on the left side of the screen, which I found very profound. Someone mentioned skipping paying their January electric bill so that they could buy tax software, because it often doesn't feel like a choice that people have. Parents in a qualitative study also said that paid software tools like TurboTax help them become more aware of available credits because they walked them through eligibility questions and made credits visible. So for families filing on their own, they often missed credits entirely because they didn't have that added level of support. So while cost is a barrier, a bigger issue underneath it is access to free and affordable support, access to tools that feel safe, supportive, and simple to use. And that's where flexible, low friction options for filing can come in. Next slide, please. So in addition to expanding access to free and low cost filing tools that can walk people through their tax credit eligibility, there's a lot we can learn from how other systems have made access simpler in other ways in the past. During the pandemic, for example, the IRS launched a non-filer tool so people with very low incomes could receive stimulus payments without having to file a full return. Similarly, the SNAP program has piloted the Elderly Simplified Application Project, which waives interviews and reduces paperwork to help older adults and people with disabilities keep their benefits. And the 2021 Advanced Child Tax Credit showed how automation can work at scale. Most eligible families received monthly payments automatically, and others could easily enroll through a very short online form. States can and are trying similar steps across the country. In Colorado, for example, we've been supporting the design of a proactive process that looks at existing past state tax data to find residents who were likely eligible for credits in the past but hadn't filed or claimed them, and then reaching out to them to inform them of their eligibility and proactively helping them receive what they were owed in the past. When paired with free, easy-to-use filing tools, these kinds of proactive approaches can reduce administrative burden for low-income families and expand access to tax credits for them. And importantly, like, states don't have to redesign the whole system all at once. They can start small by creating lower friction pathways for the households that need their support the most. These early steps don't just help families access credit sooner, they also build the foundation for a more connected, people-centered benefit system over time. Next slide, please, Kat. I think I'm almost done. I have two more barriers to touch on from our report. The other thing that came up was that many people just didn't have the documents, technology, or verification tools they need to even get started with claiming their tax credits. Half of our research participants said that they had trouble gathering documents. The most common issues were missing W-2s or 1099s, missing Social Security or tax ID numbers, incomplete banking details, and difficulty documenting expenses. Another about 15% ran into ID verification problems, things like locked accounts, lost IDs, mismatched records. And about 12% said that they lacked reliable internet or a working computer. And some even mentioned stolen phones or not having a stable address to receive mail consistently. So even before cost or complexity enter the picture, many families are stopped by something much more basic, which is just not having the tools or paperwork to file in the first place. And that's why expanding access can't just be about making tax forms easier. It also means building filing pathways that still work when documents are missing or technology is limited. Next slide, please. So to truly expand accessibility, we need flexible filing options that meet people where they are, even when their paperwork is incomplete. And this can look like, as I mentioned, simplified forms that collect only what's needed to determine credit eligibility for families who aren't required to file a full tax return. Opt-in programs that use existing state data, like data from human service agencies, to estimate eligibility and then proactively reach out to those families. Partnership with trusted intermediaries such as caseworkers or community organizations who can help verify information on someone's behalf. And adding additional ID verification options, whether that's reusing documents submitted to other benefit programs or in the past, or offering in-person or video verification through local partners. These approaches aren't necessarily meant to replace full tax returns, but they can create a bridge for low-income families who are currently excluded from the system, even when they qualify for tax credit support. Next slide, please. And finally, on an important learning and reminder for us through this research has been that many, if not most, low-income families are already in regular contact with the government through programs like SNAP, Medicaid, housing assistance, and tax credits often just don't feel like a part of that world. They feel like a completely separate world for people, even though they're meant to be benefits that people have access to in the same way. Among households that we spoke to that hadn't filed taxes in the last 3 years, over 80%, I think 84%, had participated in at least one other government program during that same time period. For families already connected to other public support systems, and existing touch points like caseworker interactions can be powerful, trusted moments to share information about tax credits. Families told us that they want agencies to use the information they've already provided to simplify access to tax filing and tax credits for them, especially when it's from a source they trust, like their SNAP office or a familiar caseworker. And that creates an opportunity to connect the dots between existing benefit systems and tax credits in a way that feels coordinated, familiar, and trustworthy. Next slide, please. States can start building some of these bridges between government support systems by taking a crawl, walk, run approach. Starting small and intentionally with the agencies that families already know and trust. A few ways to do this could look like, introducing the Department of Revenue through trusted partners. For example, a caseworker could say, you might hear from the DOR about tax credits that you may be eligible for. Even that small heads up builds familiarity and reduces skepticism about this process. Using existing benefits, eligibility information to guide outreach. Agencies can flag likely eligibility based on known income or household information and send personalized messages like, you may be eligible for like X dollars or $1,200 in tax credits. And finally, looking ahead in the longer term to stronger connections across systems, aligning eligibility criteria across benefit programs, creating clear, safe, limited information like sharing processes so that agencies can help deliver credits directly, proactively, and securely. When we start taking these steps, tax credits stop feeling like a separate or bureaucratic system, and they start feeling like part of the same network of support that families already rely on and trust. Next slide, please. I think this should be the final one. So yes, so ultimately tax credits are only as effective as the systems that deliver them. And when those systems are designed with the realities of low-income families in mind, they end up working better for everyone. And there's no single silver bullet for increasing uptake. People opt out of filing or claiming credits for many different reasons: fear, confusion, cost, complex life circumstances, simply just not knowing that filing could benefit them. And that means we need a mix of strategies that reflect how people actually live and make decisions. Like some of the things we discussed: personalized outreach that's relevant, timely, delivered through trusted messengers, simpler, more connected systems, policies that meet people where they already are. And if we design filing and credit access around people's real experience, we make tax credits not just available, but actually accessible to families who need them the most. And with that, we can go to the next slide, which is just a few more quotes and things we've heard from families through our interviews and research this year. And I'll also quickly hand it over to Simone again for a few minutes so she can share some other quick insights into some of the ways we're partnering with agencies right now to test, pilot, and put some of these ideas into practice.
Thanks, Devyani, for that. Yeah, I will just start by saying we have been now in this work with states for just over a year, and previously we're doing work at the federal level, supporting direct file and some of those other efforts. And we have been pleasantly excited by really the interest at the state level in thinking creatively about how might we do more to get folks access to tax credits. So certainly New York State, a leader on the policy side and expanding the child tax credit, and that is a huge part of it. We now have 16 states with, going on 17 states with child tax credits, and over 30 with earned income tax credits of their own, in addition to the federal credits. And so a lot of the efforts states are beginning to embark on is at sort of that intersection of policy and implementation. And so beyond the policy work around enacting credits, we have seen the state of Colorado, the state of Maryland put out policies specifically focused on outreach to non-filers. So both policies with dollars, but not often a huge amount of dollars, some small dollar amount to really enable the folks at the Department of Revenue, the folks doing the work, to think about how might we be more creative in outreach. And so that's one exciting area. Another realm in that policy space is data sharing. To Devyani's point, there are often other agencies that have data on non-filers that could help us identify them and reach them. And so starting to think about how might states share data across agencies that, respects all of the privacy and legal limitations, but that allows us to identify folks and reach out to them. We've also done some user research with individuals who have said to us, if I understood that my data was being used to help me provide me access to other benefits, I would actually be quite comfortable with states sharing data, with the state sharing data. So that's, I think, some interesting policy avenues we're looking at, and then a lot in the realm of implementation. And so Colorado passed this outreach legislation and is now launched a pilot where they're looking at internal, both federal and state filing data to identify folks that are essentially overpaying taxes. And so it's actually a process that most states use to identify folks that are underpaying. So you look at an individual's tax data and identify that they're underpaying, and they're really just flipping that process on its head and saying, can we use the same internal process to identify folks that are overpaying their taxes? And that may mean they are not receiving credits. It also oftentimes actually speaks to excessive withholdings that they are not getting back at the end of the year. And so two big pots of money and opportunities for families to get those dollars back. And in Colorado, what they are doing is pre-populating a tax return and then sending it to those individuals and saying, we believe you are owed a refund. Can you review this, sign it, and send it back? That really addresses, to Devyani's point, a lot of the barriers we see, right? It's not just knowing about it, it's having an official government, Department of Revenue, say, we believe that you are owed money, and that really lowers a lot of barriers to increase people getting those credits. There was some interesting work that was happening at the IRS during the direct file period that has translated into a program called DATS, where they actually can pre-populate part of a person's tax return, and they are encouraging states to partner with them now to actually say, we can integrate this into your state tax return process. And so the IRS is actively looking for partners on that project, and we are eager and excited for states that are interested in doing that to get help. Again, income data tends to be quite challenging for people often, like having a W-2, finding out, what your income is to file a return. And then, some of the other areas people are looking at are these integrated benefits platforms. So to Devyani's point, we often see, all of the benefits a state or government provides, and then tax returns and tax credits being totally separate. And so we're starting to see states think about, can we integrate tax credit access actually into our benefits platform, at least connect them in some way to support people when they're coming to one place to get all their benefits. And then finally are having some kind of private sector conversations and thinking about the fact that many people are filing their tax returns with private sector partners. And so what could their role be in better supporting government and their local and state government partners to increase access to credits? I think we are happy to answer any questions, but it does feel like an exciting moment. And I will say that in our work with New York City, they are also quite excited to be partnering with the state to kind of think creatively about how might we reach families, especially in this moment. Like Devyani referenced the expanded child tax credit a few years ago. It galvanized a lot of support and some creative solutions because of that urgent moment. And I think this is another one of those for New York starting in 2026.
All right, thank you. Does anybody have any questions for our presenters? Go ahead.
Thank you. That was fantastic. So your research around people feeling comfortable with information being, shared if it's for their own benefit is consistent with what we heard when New York was implementing the health exchange, right? That so much could be done on the back end and people needed to say okay. And so I'm curious if specifically any states are using sort of working with their health exchange, because we know, they have all this information too. And whether you've seen any states doing that in order to help people access the tax credits.
So we have had conversations with states. I would say Texas maybe went the farthest in trying to do this, but actually we haven't seen a state actually do it. There have been actually conversations now, just given HR 1 and other things around like what could be done to, again, both for tax credits and for healthcare access, to be able to support people that we know are, potentially at risk on the health side. And so we haven't seen a state do it, but I totally agree. I think that is a really big opportunity, and these health exchanges have a lot of data on these individuals that could be helpful.
Thank you. And I see Peter has his hand raised.
Thanks, Kat. Devyani Simone, thank you so much. That is really exciting research and great guidance to all of us. I was wondering if you would say a little bit more about two of the topics you covered. One, beyond the sort of pre-populated return, what other openness you are aware of that the IRS has for trying to support the non-filers? And also, can you just say a little bit more about the relational outreach work you mentioned, whether that was being done by government directly or government partners in the CBO ecosystem? Thank you.
Sure. On the IRS side, I will say I don't think that at the current moment there is a lot of energy being put towards non-filer outreach. The work around DATs is really like a small, the sort of shrunken version of the direct file team that are still there at the IRS trying to think about like what are use cases for our existing technology. There is a coalition of organizations kind of nationally that are still very focused on non-filer outreach, but I don't think in the kind of current priority set at the IRS level that is a big part of the work is the non-filer piece, unfortunately.
Great. Okay. I just want to make sure I had not misheard you to be more enthusiastic or optimistic than we should.
Yeah, that is right. I think that this DATS piece is like a sort of small but real opportunity on the pre-population side that we haven't had before. And then I blanked on your second question. I'm sorry.
You mentioned relational outreach
initiative
or initiatives maybe in New York City, and I was just curious whether those were direct government or government-funded CBO work.
Yeah, it is. The work in New York City, at least for now, is government, but it's actually with the NYCHA housing. So it is government partners, but it is with CBOs that are kind of connecting directly to families. I think the interesting work that we've learned, or as a field we've learned, is that official communication is very helpful, but actually so is like a trusted advisor, trusted navigator. And so the combination of hearing from a friend or family member that they access the credit, but also receiving that official like guidance from a tax preparer or from a letter from the Department of Revenue. And so trying to figure out what is that right balance. So this outreach is with government and CBO partners. And the relational piece really is individuals just emailing people that they in some way know, right? It doesn't have to be a good friend, but like have some connection with that they're testing. And there's some reasonable evidence, again, in the voter registration space that it works. There is not yet an evidence base in the tax credit world. And so that's what we're trying to test. And then the other piece is the education outreach. Since the expanded child tax credit, there's been a lot of talk about how do we get schools and the departments of education to be doing more of this outreach, given that, those are the families we're targeting. And so an attempt to manage how can we do that without overburdening an already very overburdened Department of Education.
Thank you.
Hi, thank you for the presentation. I'm curious your thoughts about, there's sort of two related elements to me that going through your presentation around the sort of awareness gaps of families, low-income families being less aware of the availability of credits as compared to wealthier, more affluent families. But then that's also like a reality gap, right? Where in New York State, until this upcoming tax filing year, a family making $7,000 a year received a far smaller child tax credit than a family making $70,000 a year. And we see with the federal credits, you have to scale up quite some time to get to the full credit. And I guess I'm asking for your sort of guidance on the sense of how much should New York be placing in sort of broad public awareness efforts or targeted public awareness efforts towards folks who are newly eligible for a much larger credit, particularly if they have very young children in this upcoming year, in addressing kind of the aligning awareness with reality. And then also, I guess the second alternative, or maybe we're doing these things together, but trying to think about like what we have the capacity to do within an upcoming budget year and what's going to take some time to roll out, more sort of targeted investments in navigation services, building more VITA tax capacity, for example, or trying to find some of these innovations to help different, the local departments of services connecting people in different ways. I guess I'm kind of big picture wise, like we do have a reality on the ground that's different now, that is different than just making people aware of things that have already been available. And I'm trying to work through kind of how we maximize that opportunity to kind of align that awareness with the new reality that is going to take likely some time for people to become fully informed about, particularly again if they have young children where the credit is substantially larger in this upcoming year for a very low-income family in New York than it's ever been before.
It's a great question that I don't know has an obvious answer. I think the awareness work, there's sort of a continuum of, with everything, the lower touch, like broad awareness has some, but a smaller impact. And the higher touch, like harder work requires like, again, more high touch, like one-on-one contact, but has a higher conversion. And so I do think the awareness in year one may have lower impact, but it's sort of like the necessary ground softening that you need to do so that every year you are, to your point, like building the general community knowledge about these credits so that more people are accessing them. But I think that what we are seeing is that the higher touch, whether it's like a navigator or even if you're doing outreach, like more than just like broad outreach to every family on Snap to say maybe you're eligible, as targeted as you can get around like we have some data that indicates you really are eligible, and this is where you should go, whether it's to a VITA site or virtual VITA, like this is who you can contact. The conversion on that is just higher, and so I think figuring out the right balance of those two things is the tricky part, because I think that broad awareness, and we saw it in even the 1 year of expanded child tax credit at the federal level, like that broad awareness and the kind of campaign, even in the New York City campaign for the expanded federal credit, did really translate into more people like asking the questions but then still needing that high touch often for the conversion. So I don't know if that's a great answer to your question, but I think we need both, but the high touch is just like has a better likelihood of actually getting somebody to file versus think about it and wait till next year to kind of more. I don't know, Defiani, if you would.
Yeah, no, I think, it's a tricky one. And it's with tax credits, like the other thing that we've heard through this and just previous, conversations we've had with non-filers is that you believe it when you receive it, which is sort of counterintuitive and counterproductive. And I think just higher like proliferation of like receipt of tax credits amongst communities is like people need to see other people receiving it, and it sort of galvanizes them more to actually like attempt filing for the first time or attempt like accessing credits for the first time. And I don't know, that's not an answer, but just to sort of name that it's one of those, if we can get even like just more communities sort of who were previously excluded, like included in the system, I think it'll have like a snowballing effect in a way that more people will want to see other people receive it. Even something that, like we mentioned, Colorado's testing out is sort of helping people receive like past missed benefits that they have, which sort of increases sort of the monetary value of what they're receiving. So some of those things can build some of the trust and remove some of the skepticism that currently exists with tax credits.
I just want to add one point on the awareness, which is just to say, again, going back to the 2021 expanded federal credit, one of the most effective low-touch outreach mechanisms was actually other agencies, so Social Security, putting up banner ads on the website to inform people about these credits. So putting up information in other places where people are going to get benefits to tell them about this new benefit. Because again, it's like a trusted government source. And so those kinds of broad outreach certainly cost something, but like much less than, an actual campaign. And so I think those are other really good strategies.
I think those are really helpful answers. Thank you. Excuse me. And that's why I'm excited. Our next presenter, which we're not jumping to yet, but just as a preview, will be from Minnesota, where they did not have any tax credit before 2023 at the state level. So they also had this reality gap where it was not telling people, oh, this something existed that you were already eligible for and you should know about it, but the invention of something new that they had to get the word out. So I think there'll be some practical examples that I think echo what we've just heard from Devyani and Simone. Thank you both very much. Anyone else? Anyone else?
Okay, well, thank you, Devyani and Simone, for your presentation, and to you for all of your questions. That was a really informative presentation. We were so excited to find your research and to see how much it aligned with the themes that we've been discussing over the last 3 years with this council, and while also centering the lived experience of low-income families to illuminate a path forward. So thank you. And it was so valuable to see how respondents describe their experiences in their very own words. We're pulling back up our PowerPoint, which will include some of the key points that I hope that we take away from Devyani, and including her findings related to tax credit awareness, including the fact that 28% of New York respondents were not aware of any tax credits, compared to 24% nationally. And 36% of households with incomes under $10,000 a year were not aware of the child tax credit. And that number jumps to 38% in New York, which is over twice the rate of households making over $150,000 a year. And among low-income households who have not filed taxes in 3 years, 84% received other government benefits during that period, with the majority receiving SNAP. So 58% of New York non-filers received SNAP. These facts point to challenges that we have to address, but also some of the potential solutions we could explore across agencies. Her results also included factors that kept families from claiming tax credits like the CTC, including believing their income was too low to qualify for the credit, which of course was an understandable belief in New York until the governor took action to eliminate that wage phase-in. Fears of making mistakes was another major factor for respondents. 61% of respondents who reported fears of making mistakes had not filed taxes in 3 years, at least. Many respondents cited concerns that the credit would impact other benefit support programs like SNAP, leading to loss of benefits, which, as we talked about, is not accurate for annual tax credits by design. And the cost of filing taxes is also a common barrier that we are all more familiar with. 40% of New York respondents reported this as a barrier to filing. And similar to what we learned from New Yorkers in our own public benefits survey, respondents report difficulties gathering all the various documents that are required to file. 56% of New York respondents reported trouble gathering documents, and 70% of those had difficulty with more than one document type. And lastly, Devyani outlined strategies states can implement to increase tax credit uptake, including making sure that those messages are supportive and actually tailored to real New Yorkers and their motivations. And this includes clearly framed messaging around the opportunity for families to get money in their pockets, not around compliance, obligation, or punishment. Messaging also needs to make clear that the credit will not impact their existing benefits. And another key takeaway was the importance of using multiple channels to communicate this messaging, as respondents indicated that they wanted to receive multiple reminders from different sources, including trusted messengers. And finding ways to reduce documentation requirements for filing and cost barriers to filing. Ultimately, Devyani and her team underscore that the goal for states should be to provide clear and simple instructions that are encouraging, understandable, and easy to follow. And repeat that message early and often across platforms, especially during key moments for filing, like January when the season opens, or April ahead of the filing deadline, or later in the fall, like she mentioned, so that people can receive those messages from both government and trusted community partners across the year. And with that, we'll take a quick break. We'll start back up again at 12:25, if that's good. All right, thanks, everybody.
And also just want to acknowledge that their research is really new and recent. It came out in May of 2025, so it's hot off the presses, and we're bringing it to you here as soon as we found it. So thank you all for the work that you've done, and we'll stay in touch with you guys. Appreciate it. Thank you so much.
Thank you.